or patients that are on metformin. Metformin is a diabetic hypoglycemic agent, or the PPIs, the Protonics, the Prilosec, those kind. Vitamin C is your ascorbic acid. It is functioned for tissue repair and growth, for the formation of collagen, absorption of the iron. It helps with that. Your food sources is your citrus fruits, your cantaloupes, your tomatoes, leafy green vegetables, potatoes, strawberries, and kiwis. Deficiencies, when you're deficient on your vitamin C, it can result in poor wound healing. A lot of times when we've got patients with major wounds, we'll give them vitamin C, extra doses of vitamin C, sometimes even twice a day to help promote that healing. They'll have bleeding of the gums. They'll have scurvies, can lead to some infections. When you've got an overdose of vitamin C, they'll have GI upset, especially diarrhea. Your folic acid, folate as they call it, it's used with DNA synthesis and body growth. You get that with your leafy green vegetables, yellow fruits and vegetables, organ meats, black-eyed peas, and lentils. Deficiencies in that, you'll have a decreased white blood count. You'll have decreased clotting factors. Can lead to anemias. The intestinal disturbances can even, in some patients, lead to them being depressed. With your female patients, if they're contemplating on getting pregnant or have discovered they are pregnant, the folic acid is very important, especially in that first trimester, that we've got to get the folic acid in there. It is very essential because during those first 3 months is when you have neural tube development of your fetus. And without that, it can cause neural tube defects. You can have problems with spina bifida or central nervous system developments. It can also lower your phenytonin, your dilantin, which is a seizure medicine level. So you have to watch your patients, again, their levels, monitor their levels of their phenytonin when they're on the vitamin C. Minerals. One of the minerals is iron, or thiosulfate. Its function is to improve the hemoglobin formation. You will find that frequently in liver, lean meats, beans, green vegetables, and egg yolks. When you're deficient in your iron, it can lead to anemias. Some foods, and especially antacids, will interfere with the absorption of the iron. Some of the oral forms of iron has been known to upset people's stomachs, so you may ask them to take it with some foods. But just make sure that the food is not one that's going to interfere with that absorption. You'll need to let your patients know when they're on iron that their stools will be dark, sometimes even black, that they need to watch that. Zinc. Zinc is essential for normal growth, tissue repair, wound healing, and it even affects their taste and smell. And then we have selenium, which works with the vitamin E. It's an anti-carcinogenic effect on the vitamins. Got any questions? I know it's a lot to take in.
I do.
Okay.
Common deficit for vitamin B12.
A common deficit. A lot of it is your patients that are your vegetarians, because they're not getting the B12 that they need, because a lot of it comes in your meats and they don't get it in meat because they don't eat it. They usually take supplements for that. They can be prescribed. It is advised to at least give them an hour apart. because the vitamin E will interfere with the absorption. Yes, ma'am. It's 10, it is, ma'am, yeah. Make sure when you're reviewing to know the difference in your fat-soluble and your water-soluble vitamins. Know some of the toxic symptoms, some of the deficiencies on your vitamins. Know, like with your warfarin, the contraindications that you'll want to see, when you can use it, when you don't. What patients do you want to use it cautiously in? What is some nursing indications for your warfarin that you want to teach your patients? What do you want to teach your patient as far as your food sources go when taking the warfarin? What is used to counteract the warfarin if the warfarin level gets too high? What lab values are you going to monitor when the patients are on warfarin? What is some of the uses of, like your Plavix and your warfarin? What do they use that for? What is the patient supposed to tell other physicians before they have procedures? How long do they need to hold that medicine before they have procedures? I've got a post-test and an evaluation that I'll hand out. When you get those finished, just send them to the middle aisle, and then you got a 10-minute break.
If you have some at the end of the row, I'll come by and pick them up. Have what else? Name? No, you don't have it. No, you don't have I know.
your pharmacology book to get information. What? This meeting's got it. Some over here, this meeting. They need some of the email. I appreciate you listening. If you have any questions, you can ask Ms. Manning. I'm typically here one day a week. But if you have any questions, just let me know, or Ms. Manning know.